Hi, everyone. Welcome back to Healthcare Quality Week. I'm Stephanie Mercado, the CEO and Executive Director of the National Association for Healthcare Quality, also known as NAHQ. We are approaching the second part of our three-part interview series for Healthcare Quality Week. And I am joined today by April Taylor, who is the Vice President of Quality at the Johns Hopkins Hospital. So as a quick reminder, before I jump in with April, just setting the stage for everybody here, we began our first conversation with Josh Berlin. He is the CEO of Rule of Three. They are an advisory services organization for healthcare. And we talked really broadly about what was going on in the healthcare environment. And as we thought about planning for 2022, he gave us some ideas about what should be on the radar of people working in quality so that they could effectively plan for 2022. We sort of go from that very high level view and bring it down a notch to where the rubber hits the road in the healthcare organizations and where healthcare leaders like April are really planning to advance their organization's goals and to support their teams in 2022. And then the final installment will be with Emmett Irvin. Emmett is at the University of Maryland Medical System, and he is also a NAHQ board member, and we'll talk a little bit about how you can really prepare individually through continued professional development, lifelong learning, to make sure that you personally have a plan for success in 2022. So we've got a great lineup. In April, I'm excited to get going with our conversation. So welcome to the interview series.
Great, thank you for having me.
All right, so off the top, we have about 15 minutes here together, and I want to make sure we, get to it. I know you have a lot of great feedback and insights for the audience. So when we talk about the pandemic, which is hard not to always have at the forefront of the conversations, we talk about the pandemic and the impact it had to planning for organizations in 2022. I know a lot of our people feel like they're still in the eye of the storm or just barely kind of coming out of that. And so what do you say and what do you think about planning and how do you approach that given the circumstances that we're in?
Well, hopefully we're riding out the last wave of the storm. But with that being said, in healthcare, we were really in a reactive mode for a long time with the pandemic. And honestly, we had to place a pause on planning. But I think that what we all know is that quality cannot wait, right? And so as we look forward to next year, there's an increased emphasis on honestly getting back to basics, right? There are a lot of practices that we abandoned when we were more or less in a crisis mode. Just last month, the CDC reported that HAIs, so healthcare associated infections, increased significantly in 2020 after years of steady decline. And they potentially attribute that to things like the challenges related to the pandemic, things like staffing shortages, high patient volumes. Similarly, Joint Commission reported that they saw an increase in sentinel events reported to them over the last year. So I say it again, healthcare quality can't wait, right? We need to get back to planning. So, going back to response to your initial question, how has the pandemic sort of impacted organizational planning? What does that look like in 2022? What I will say is that planning will be a lot more nimble than what it used to be. We need to get back to our core business, but also understand that we need to be flexible, right? And we need to plan for the unexpected. So back to basics, back to planning, but we know that the pandemic is going to be here. And so we'll need to be flexible in our approach with how we do both our core business and also make sure that we're preventing patient harm while improving quality and outcomes.
That's great. What I'm hearing a thread kind of running through your answer to that question is really all around sustainability. So NAHQ actually just did some research that we'll be publishing early next year that highlights the fact that our respondents told us that on a national survey that system sustainability, in their opinion, was like the #1 focus for 2022 and beyond. Because a lot of us thought that we had systems in place that would stand the test of time and weather a lot of storms. And in fact, we really didn't. Which brings me to my next question, which is around prioritization. So given where we are and all of the things that you need to tackle at your organization and all the other leaders in healthcare need to tackle as well, Talk to me a little bit about how you decide even where to start in terms of your improvement activities and other quality initiatives going on in your organization.
So I'm a data person, so I'm going to say with data. But I think, outside of data, which obviously we use to help us prioritize our areas of focus for the year, I think what's actually a lot more important is recognizing that we have limited bandwidth, right? We can't do everything that we want to do in any given year. And so it's really important as healthcare quality professionals that we leverage the tools in our QI toolkit, right? So with the pandemic, we had to design better and learn faster. And getting back to your comment around sustainability, what we now need to do is move all of these projects into operations, right? Moving projects into operations and making them sustainable is what gives us the bandwidth to take on these new and emerging priorities that are there. Now, sustainability is not a new concept, right, for us in healthcare quality. It's part of what we do all the time. So lots of organizations use different sorts of frameworks for healthcare quality, but let's say that we're using Six Sigma, right? And if you're using Six Sigma and we're talking to NAHQ, well, the last step is the control phase. That's all about sustainability. So we know that in healthcare quality, it's really around how do we share our knowledge with our operational leaders and other folks to move things from projects into operations. When you think about a lot of tools we use in the pandemic, those are going to be the tools that we need to use as we move forward. So human factors, workflow redesign, using lean to get rid of waste, using Six Sigma to address variation, digging back into our foundational toolkit for healthcare quality, that will help us to build synergies with our work. It'll help us to be more efficient with our work, and hopefully help us to address the issue of how do we do all of these different competing projects and competing demands at the same time. So to me, prioritization is really around creating synergy with all of the various work streams that are out there. And that way we'll avoid sort of further stressing our healthcare workers.
So I love the statement that you just made. I wrote it down: design better and learn faster. You always have the best mantras, and I'd love to steal them from you. So hopefully I will have a bunch of people who have written that down to design better, learn faster, and we can all be doing a lot more of that. So thank you for that input. And when you talk about the data and the planning and the goal setting, do you have one goal or two goals that come to mind that are really important for you in 2022 for planning?
So honestly, I think it is really getting back to basics. We think about key priorities that I see across all healthcare organizations for 2022. It's really looking at things like HAIs, healthcare-acquired infections. It's looking at hospital-acquired conditions as well. With a lot of the visitor restrictions that went into place during the pandemic, there was, an increase across the board when you look nationwide at a lot of those areas that we had, had under control for a long period of time. And so to me, those are really the areas that I see being prioritized across the board.
So just a quick follow-up question on that. So one of the things that I've been thinking a lot about is I read that report as well about the increase in HAIs. And I was thinking about, well, how do we, and the notion that we've, sort of stepped 5 years back in time from an outcomes perspective. And I thought, well, how are we going to get back to where we were and back to that baseline and then build from there? And it occurred to me that we might not be able to go back to that, and that we just have to start where we are with what we have. And that there's the notion that we are in maybe year zero in 2022 to sort of say, okay, fresh start, new game plan. And it is a lot of go back to the basics. I hear you on that, but at the same time, it's like, but with a fresh lens, the fresh energy. What was that? Learn, design better, learn faster, all of that kind of stuff. So how do you approach that? So when you're trying to bring those HAI numbers down, what do you use for a starting data point, and what are you aspiring to, given the situation that we're in?
Yeah, so although I think we certainly do need to go back to the basics, I do think there are a lot of practices that we just couldn't maintain with limited staffing and needing to do things differently for COVID. So one, I think we do need to reestablish a baseline. But I think going back to the idea around sort of designing better, learning faster, there's a component to innovation there, right? And that's really what we did during the pandemic. During the pandemic, folks were incredibly innovative. They were nimble. Projects that normally took 6 to 9 months to get done, you got it done in, I'm not even talking, 3 months. Things happen in a week, maybe even 3 weeks, right? And so I think that there is a different sense of urgency around how we can do healthcare quality improvement and how we can actually maybe speed up the pace of change. So although I know the report says, wow, maybe we took a step back of 5 years, I don't think it's going to take us 5 years to get back to where we were. Because I think one of the tools that we have learned in the pandemic is how we can do things better, how we can do things faster. And that in being more nimble and being innovative, we can sort of restore all the losses and get back to a position of really improving a lot sooner than what we had done previously. So it's really about learning, right? We need to learn from our recent, history, but also from the past.
Mm-hmm. I remember in speaking with Governor Levitt at NAHQ Next, he was one of our speakers, and he mentioned that he thinks that on the road to value, we're at about the 25-year mark on a 40-year journey. And as I think about COVID and the experiences that we had and all the lessons we learned, I can't help but think that experience became hopefully an accelerant on that journey, and it kind of refreshed us and kind of pulled us out of some of the necessary drudgery to get through a 40-year journey, and said, hey, there is a different way to do this. We can be more agile, we can be more flexible, and we can get really good work done fast. So I'm so excited about that. So, well, I think we're going to be wrapping up here pretty soon. We've covered a lot of ground in a very short amount of time. So I want to thank you for your time here today and all of your great information.
So I have one other comment and then a question for you. Because I touched briefly on the idea of data and how that's really necessary for prioritization. And I'd be remiss in not mentioning the importance of data as we think about planning for FY22. So often, even as healthcare quality professionals, we think about only using data at the end of a project, right? We think about using data at the end to measure whether or not our intervention worked. But when I think about data, data is used throughout all phases of improvement. It's used as a signal, right, that helps us identify something's going in the wrong direction, like HAIs or hospital-acquired conditions. It's then used to prioritize where are we going to focus, right? So we're going to pull in our quality toolbox and use things like Pareto charts. Here are our top areas for opportunity. We're then going to use it to actually measure improvement, and then we're going to use it in that monitoring and sustain phase. So using data throughout our process will help us in planning, improvement, and really getting back to where we were instead of sustaining those gains that we've lost during the pandemic.
Yeah, great point. Glad you brought that up.
One final question for you, if I may.
Mm-hmm. Sure.
So my question for you is, how is NAHQ making it easier for quality leaders to both access and analyze data related to the healthcare quality workforce and really help them to make better informed decisions? That's something that certainly I think a lot of us are struggling with.
Yeah, so we are making a lot of progress in helping leaders understand their workforce. One of the things I will just share by way of background is we talk a lot about reducing variability in healthcare delivery and understanding what's driving that variability. And to your point, whether that's qualitative or quantitative data, we don't have a great understanding about competencies of the workforce, of the quality workforce, and the understanding and acceptance that maybe our competencies are what's driving some of the variability in healthcare delivery. So kind of want to use that as a backdrop and say, one of the things that when you start to think about that concept and try and say, well, we want to reduce variability in healthcare quality competencies, we want to make sure our workforce is prepared to do their best work. We think about the need to understand from a sort of organizational perspective, who is doing what quality work in my organization and how can I help them do that work better and remove any barriers that they may be experiencing. So NAHQ just this year is in beta on a program we call Workforce Accelerator. And what it does is it gives organizational leaders a bird's eye view into who is doing what work in relationship to NAHQ's healthcare quality competency framework. So we stratify the workforce's work against 8 dimensions, 29 competencies, and 486 skills statements, which seems a little overwhelming. But what's really great about it is that you can finally kind of figure out how do all of the people who are contributing to the work really do their work independently, and how do they fit together with other contributors as well. And so the analytics and reporting, to your point, data-driven decisions that we're able to show, we are working with a beta client right now, and what we observed, and we can tell them definitively with data, although they sort of sensed it before, was that across the 8 competency domains, all of their guns, director, manager, and coordinator levels across all of their markets in every hospital are pointed largely at 3 competency areas, and the others are falling off. And so this is a huge eye-opening, resource for them to say, oh my gosh, like, we're really glad we're doing well in these 3 areas, and we got a lot of guns pointed in that direction, but we're not as far along as we thought on performance improvement and population health and in other areas. So that for us has been really meaningful work, because we can help them get that bird's eye view and really drill down. We're also giving insights to say, okay, if you're not as far along on performance and process improvement, for example, why? Let's drill down another layer. Is it that your people don't know the PI skills? Is it they're not adept at change management? Is there culture issues here? And we can literally unpack that. So I'm really excited about the work that we're doing, because I think it will help diagnose and treat some of the challenges that the workforce experiences and the leaders are experiencing with regards to deploying that workforce towards quality. So lots of progress being made. We are in beta now, and we'll be in full launch in 2022.
Well, I can actually feel your excitement through the screen here. As a sort of proclaimed data geek, I'm really looking forward to getting access to some of that data and digging in myself. Thank you.
Oh yeah, absolutely. I know I get a little lost in it. It's really fun to kind of see, where we are, and to really look at the opportunities for the future. My highest hope for what we're able to accomplish here at NAHQ with regards to this work that we're doing is that we can actually put shape not only around what goes on at organizations, but that we could do it for this entire profession, and that we could start to make prospective recommendations about what good is like, so that locally organizations are not sort of developing this, on the fly without the benefit of a standard. It just doesn't have to be that way anymore. And that is an amazing contribution that NAHQ has made. And I'm excited to have been a part of that. So, all right, well, with that, we're going to wrap it up here, everybody. Thanks so much for joining us for the second installment of the Healthcare Quality Week interview series. As I mentioned, next up is going to be Emmett Irvin, and he is going to talk about preparing your own self for success through personal planning for your own career growth. So thanks, everybody. Appreciate your time, and enjoy Healthcare Quality Week.